Are we ready, John? Yes, we are. All right. We're going to start where we always start, which is updating our community on our fellow citizens that we have lost. And we are reporting total numbers today of 1,149 Detroiters who have died since this pandemic started. That's 21 more than was reported yesterday, but only 6 of those deaths occurred in the last 3 days as we continue to clean up old data. So again, in my mind, the standard is, are we week to week cutting in half the number of fatalities in our community? For a while there, they were doubling, and the goal is to be cutting them in half. And again, you'll see the updated numbers. 4 weeks ago, 262. 3 weeks ago, 276 deaths. Terrible point at the peak of the pandemic. We dropped to 210 2 weeks ago, 115 last week, and 55 deaths in the last 7 days. Again, another new low. I have joining us today Dr. David Strong, who was the on-site medical director at the TCF Hospital the field hospital over at the TCF Center, and Dr. Howard Klausner, his assistant at that site. And we're here for a point of, I think, great celebration in this community, and that as of today, there is nobody over at that field hospital. It is officially closed down. And I want to get a chance to hear from them, but I want to talk again about what a remarkable accomplishment it was. On April 1st, the governor, the Army Corps of Engineers, the National Guard, and a whole lot of folks started to build it and announced it. April 1st was here. April 10th, it opened. At the time that it opened, we were on a straight line up. And it was a very reasonable conclusion that we were going to need 1,000 more hospital beds than our hospitals could handle. And had Detroit been like many other cities in the country, and this trend line had continued up, we would have needed them. But they dropped almost immediately. I'm not sure they ever got much above 15 or so, maybe up to 20. And then they have dropped steadily because the people of this city did something remarkable in really committing to the social distancing standards to now to the point where it is a small number of new fatalities every day. I want to thank Lynn Terosian, who used to be a hospital president for me at the Detroit Medical Center, who did a great job running the TCF Field Hospital, and she was celebrating the reduction in the number of patients every day. Governor Whitmer, who did such a great job at setting it up in the first place. Dr. Jenny Addis, who runs the regional emergency response, who had the vision in the first place to make it a COVID facility, not a non-COVID facility, which some other cities in the country made a mistake on and had to change it. Dr. Addis had us on exactly the right path from the beginning. A large number of the beds are going to stay there on reserve. Right now, things are going our way. But if we decide to abandon with the warm weather, the social distancing, we'll need those beds over at the TCF Center again. And I'm hoping that they're going to stay there empty, but we need to be careful. And so what I'd like to do right now is to formally thank every one of the men and women of the Army Corps, the National Guard, the medical staffs, who did such a great job at setting it up, at having us be prepared. And the person who was leading that on site was the medical director, and I'd like to ask now Dr. David Strong to talk about what your experience was and what your feeling is now that you're going back to work at Henry Ford.
Thank you, Mr. Mayor. I'd first just like to echo the message of the mayor, and that I think this was a great collaborative effort, and the fact that we didn't need to use it to the extent that we planned for is really a testament to the will and commitment of the local citizens in following the stay home, stay it safe orders put forth. This was, again, an amazing collaboration between the city of Detroit, the state of Michigan, and then also federal resources as well, to really build something unprecedented and in an unprecedented short amount of time, so that resource was available here for the citizens of Southeast Michigan. Like the mayor said, the Army Corps of Engineers, the Public Health Service, tons of Department of Defense assets, and then as well as the local health systems all really contributed to making this effort a success.
All right. Dr. Clauser, anything you want to add?
No, I think things have been said very well so far. I think it is a testament to the numbers of organizations that have come together, to make the field hospital a reality at TCF, and it's also a testament to the citizens of Detroit and the citizens of Michigan that have rigidly stuck to the social distancing directives.
So April 1st, I said to the people of this city, your report card is going to sit right down the street at the TCF Center, and we got our report card today, and it was remarkable. I want to thank another international company. It seems like the world has been behind the city of Detroit, but we just got a donation of 300,000 surgical masks and another 50,000 N95 masks from the Chinese company Tencent. If you don't know Tencent, they're one of the largest companies in China, a leader in video streaming, in online video games, probably the largest company in the world, in instant messaging and the like. And if you're wondering why one of the largest companies in China would donate here, several of the Tencent executives are graduates of the University of Michigan, including Martin Lau, the president of Tencent Holdings. And I'd like to thank Mr. Lau along with Brent Irvin from Tencent North America. But we are in a position now where the funeral homes, the grocery stores, any place where there's a gathering, we're in a position to provide masks to people who don't have them. I just continue to see people on the street every day in the city being disciplined and wearing their masks, and you can see the results in that scorecard. I'm going to take a minute and do a PowerPoint to give you another sign of our recovery. So with me today is Don Rencher, the head of the City Housing Department, Linda Little, the head of NSO, and David DiRita, the head of the Roxbury Group. And so the governor today has lifted the ban on construction in the state of Michigan. And in Detroit, we have had most of this state's construction for a while, and we are getting started even today. And we know that one of the obligations we're going to continue to have is affordable housing, particularly considering how hard the city's been hit economically. And so what we are announcing today is the resumption of work on 6 major housing projects, $120 million in investment, 370 new housing units, and 46% of nearly half will be affordable units. Starting today, David DiRita and Roxbury are working on Parker Durand over on Kirchville, where they are building 92 new units, $22 million of work that's going, and it's right down the street from me. I've seen you guys clearing the dirt, and I'm really glad to see that we're going to get this done. We also are doing a rebuild of the Kirchville streetscape, which is going forward as well. We announced that project about a week ago, but we're getting people back to work in this city. In Midtown, 26 new units will be starting there this month. They'll build the affordability phase in phase 2. Sugar Hill, also in the Midtown area, 68 new units, 14 of them will be affordable units for veterans, another $36 million project. Linda Little and NSO have started work over at the site of the old police precinct at Mack and Gratiot. The construction was going extremely well before the pandemic derailed you. But what NSO is doing is building shelter beds and permanent supportive housing units. In this city, we have been addressing the homeless issue not by recycling folks on shelters day after day where you come in at night and we move you out at 8 in the morning, but more and more moving people to housing permanently where they've got support, whether it's addiction issues, help finding jobs, mental health support, or the like. We are moving to a strategy of permanent supportive housing in this city. We've been building a lot of permanent supportive units, and I'm really glad to see that NSO will be moving forward. We will have 56 more permanent supportive units, again in Midtown, at COTS Peterborough. And that $15 million rehab project is moving forward this month. And over in Jefferson Chalmers, we have this, what had been abandoned apartment building. It's a $5 million renovation, 23 units, and half of them affordable. And so across this city, you will see people going back to work on construction projects. There'll be many more coming, but Donald Rencher and the Housing Department have put together the financing on all these projects. We are going to build a city where there is quality housing available for people of all incomes. And I will continue to say this, particularly in the Midtown area. I want the doctors and the nurses working at our Midtown hospitals, the professors at our universities, to be living in the same neighborhoods with the folks who are pushing the wheelchairs, preparing the meals, cleaning the hospitals. That's what this city is about, is quality housing for people of all income mixed into neighborhoods together. And so we're glad to be pursuing that vision again. And with that, let me start with the person who started her project first. Linda, I know Sheila Clay, you've named the center for. Sheila's now working for the city of Detroit in our employment training. But why don't you tell folks what you're building over there on Gratiot and when they can expect to see it done.
Well, Mary, you did a great job explaining an overview of the project. It is permanent supportive housing, which is phase 1 of the project. And we are expecting that project to open this summer, thankfully, through starting construction today again. We may be delayed a couple of weeks, but by late summer, that first phase will open, and we'll continue on to phase 2, which will be the shelter beds, as well as a community integrated health clinic. And then we're also doing something new for the city of Detroit, which is medical respite, really providing a continuum of services for the homeless population that will include those who are recently discharged from the hospital. As you know, I came from DMC too, so we understand very clearly the need for this population to have some place to safely recuperate. And so that whole continuum will be on that campus, and it's the first campus of its kind in the United States. So we're pleased to have it here in Detroit.
And so we're excited to have you moving forward. And David DiRita, who has built a number of projects, has been calling me every week saying, as soon as the construction ban's lifted, I will be out there the first day. And I haven't driven by Kirchville yet today, but did you start work on Parker Duran?
We are out there today, and it was good timing, and I want to start by just thanking you, Mayor, and your entire team for your leadership in helping the entire development community sort through best practices for restarting of construction, because I think while construction is naturally an industry that carries a lot of safety with it, and I think is an industry that shows leadership in that regard, I think the fact is we all got better for it, and I think the workers very much appreciate the attention on their own safety that has come along with this effort, and appreciate, by the way, the availability of testing, which you've been able to provide. But we're out there. It's good timing. Before the shutdown, we'd gotten the foundations in. I think the community will be very excited to see steel rising on that site in the month of June.
And we are continuing to set the standard, as David mentioned, because these are financially supported by the city. These work sites are governed by city standards, and so all of the construction workers will be checked for their temperature, checked for symptoms every day. They will have masks on, they will be distancing, and the city B-Seat inspectors will be verifying that. And all of this was put together through the efforts of our housing director, Donald Rencher. And I know Donald's looking forward not just to getting the 6 projects resumed, but starting several more. Donald, you want to talk about what we have going on?
Yes, thank you so much, Mayor. Again, I am really happy about us starting to get back to business again and developing again. We need these units more than ever, and we're going to continue to push. Right now, one thing I'm particularly proud of, in the next 3 to 6 months, we have another approximately 300 permanent supportive housing units that we're going to be closing on and hopefully start construction soon. And so we're working on that. I know right now we're also looking at preservation and trying to figure out how we can get those up and running. And we have to be very detailed and strategic in putting protocols together, because preservation units actually have people in their units. And so right now we're working with Dr. Dunn and other consultants to put protocols in place so everybody can stay safe, especially the people that are currently residing in those units. But again, it's very important that we are providing housing opportunities specifically in this time for people across the income spectrum, and we'll continue to work, although it's different because we're closing remotely and driving to parking lots to sign documents and to get things done. It doesn't stop the need of Detroiters and what we have to do in the city to get housing prepared for people. So thank you, Mayor, again for your leadership, and we will continue to push to get projects out.
And before I turn this over to Denise Fair, I don't normally promote the show coming up following us, but I would encourage people to watch the governor's presentation at 3 o'clock. I've had significant input in what she's doing, and I think what this state, what these folks have wanted for a while, is to have some predictability about how the economy reopens, what the standards are, and what you can expect. And I think you will see the governor's done an excellent job. She has an excellent plan that I fully support. And for those who may not be tuning in every day, this is the day you want to catch the governor's show at 3 o'clock, because I think you'll see at least what the pathway is from where we are today. It's going to be a long one, but I think you can see how it's going to work. And it's something we've been just really pleased with the job that she's done. With that, I'll turn it over to our health director, Denise Fair.
Thank you, Mayor, and I'll make sure that my comments are brief because I too will be watching the governor at 3 o'clock. So first I want to say Happy Nurses Week. We kicked it off yesterday, May 6th through May 12th. I want to thank all the nurses and the medical assistants at the Detroit Health Department, of course, across the city and our state. Thank you for your compassion and your leadership. Now, every day I receive numerous questions via social media, email, when I'm out and about, people just asking questions about COVID. And I thought one question I would just share with all of you. Someone asked me if they should be concerned about COVID-19. They were really sincere. They added that they didn't personally know anyone who had the virus. They didn't feel sick. They didn't really feel impacted. So let me say this without hesitance. This virus is real. We should all be concerned about how it is impacting us, our family, and our friends. There are more than 3 million confirmed cases worldwide, more than 1 million cases here in the U.S., more than 43,000 cases in Michigan. And in Detroit, as of today, we have confirmed 9,592 COVID cases and 1,149 deaths to date. For families who have lost loved ones and dear friends, this is unfortunately all too real for them, as well as for those who are praying for their loved ones that they pull through, like my 90-year-old great-aunt who is currently fighting the fight right now in Benton Harbor. Since our first case in early March, the Detroit Health Department has been strategic in mitigating this virus in our community by focusing on congregate settings such as long-term care facilities. As of today, we have completed testing in 26 sites and expect to complete our testing by the end of this week. The infection rate is still hovering right at around 10%. This virus is in our community, but I want each of us to continue living our best life, but with our safety and our safety of others in mind. And although the class of 2020 won't physically walk across the stage or have a huge celebration as many of us did, I have faith in all of us. We are Detroiters, we are strong, we are creative, and we will not allow COVID-19 to let life just pass us by. So as you're watching your favorite TV series or movie, get some exercise and arm yourself with knowledge via these daily press conferences, via the health department website at detroitmi.gov/health. Finally, I just want to say that I am extremely proud and I really feel good about the progress that we have made at the city. But I still urge caution and remind you all to make sure that you practice social distancing, wear a mask when you are out in public, and please do wash your hands. And with that, I'll turn it back over to the mayor.
We'll take any questions.
Good afternoon, everybody. And I've been by this apartment building. It's a really cool building, so I'm glad that it's not going to get knocked down. ML Ulrich, Detroit Free Press. I wanted to ask you, Mr. Mayor, and maybe some of your colleagues here can speak to this. There's been a lot of talk about how government and agencies have been very active in terms of reaching out to people who may have been forgotten before, the homeless, people whose water was turned off. And there's been conversations about how this massive effort, it would be a shame if it just went away along with COVID-19. Are you seeing something in the way that your administration is working and opportunities to continue to be this engaged with maybe some of the disenfranchised people in Detroit going past this crisis and further out into the future?
I think what I just showed you shows how deeply engaged we have been all along. What you are seeing there is a large number of affordable housing units being built, permanent supportive housing units being built, shelter beds being built. They didn't start with COVID-19. These have been in the works in the last 2 or 3 years. And when COVID-19 hit, we didn't have to scramble with our homeless agencies. Don Rencher and his team had the nurses out twice a week in these warming centers and the shelters immediately, and we've seen a dramatically lower infection rate among our homeless than we have seen among the folks in the nursing homes. But, you know, maybe Linda, who does this every day, I'll defer to her as far as this community's commitment to those who need a little bit more help.
Yes, thank you, Mayor. I would echo that. With the support from the city and the Detroit Health Department, we have made a very concerted and collaborative effort to reach out to the most vulnerable in our city, to make sure that their basic needs were met, to make sure that their water wasn't turned off when they needed the most, to make sure that they had food, which has been a major need for the populations that we serve. Even at NSO and other shelters, because of the shelter-in-place order, we've been meeting all of our clients' basic needs, whether it's laundering their clothes, providing 3 meals a day. At NSO, we even ramped up our medical clinic from 2 days a week to 5 days a week, started telebehavioral health services, meeting substance abuse needs. So we're really trying to anticipate what the needs are, and we're going to continue to do that. But I think the mayor and his team have done a phenomenal job with even mitigating the spread. You know, in the homeless population, we haven't seen what many other cities, large cities, have seen. And that's because of the hard work of the city, the health department, and all the shelter providers. So I think that we've done a great job together, and we're going to continue to do that to look out for Detroiters.
Okay, thank you very much. In terms of some of the data that's been available involving COVID-19, there are some city resources available online where there are multiple options to download the data. I'm thinking particularly of a page that allows you to get the data by image, by PDF, or by PowerPoint. We're wondering if my colleagues who are much savvier with the IT stuff than I are wondering if we could enable the data button so that we can get that raw data down and then do whatever the data wizards do with it.
Denise, do you have a problem with that?
So we are considering that. So right now, if you do go on the website, there is an option for you to click on PDF or a PowerPoint, but in terms of the underlying data, that information is not available at this time.
Okay, and do you anticipate that it will be at some time, or that you'll make a decision on whether it can be?
Yeah, so I have daily conversations with my epidemiologist and her entire team, and so I think at some point we'll be able to offer that, but at this time that's not available.
So Denise is kind of smiling there because there's normally about a half hour a day of me cross-examining them on the accuracy of the data. It is amazing the deficiency in basic data collection in this state and in this city that this has exposed. I mean, every day you are seeing deaths from April 6th posted in May because of those problems. So I think at this point you're hearing from the health director, she's a little reluctant to vouch for the accuracy of the underlying data, but as soon as we feel confident in it, we'll make it available.
Okay, and mine's immeasurably superior to my own, are willing to work with the city to exclude any personal information that may, if there's a hesitation, we may lead to someone's private information, we'd be happy to do what we have to do to make sure that doesn't happen. Mr. Mayor, in terms of construction returning, some of the more high-profile projects that people have been talking about, the train station, Hudson's, what have you, do you have a sense when those crews will get back to work, or are they at a point where they're not quite ready to do what Roxbury may be doing on the east side and other places?
Everybody is in a different stage. Some are in now, cleaning and getting ready. Others are a little bit farther away. But it's really not for me to announce their construction schedules, but I think you'll see several of them get moving very quickly.
Okay, and is it your opinion that based on what the city has done and what the governor has done or may be poised to do, that if you have a project that you would like to get going, that there are now no executive orders or other impediments to doing what you think you can do?
There's no reason construction can't be moving full speed ahead, and I can tell from the daily numbers I get at the fairgrounds that huge numbers of construction companies are running their employees through the fairgrounds tests right now, getting ready. But no, there's no restriction other than the fact you're going to have to follow the procedures on temperatures and masks and distancing. But the construction industry can move full speed ahead in Detroit, and I think you'll see it be probably the first industry that's all the way back.
Okay, and for Mr. Rencher or Mr. DiRita, given the construction season, have we lost much time so far in terms of getting projects going, or are we right about on schedule where you would be if the world wasn't on fire?
Well, I know David has a on the ground, but it has put us back. The mid-March timeline, when we shut things down, that was around the time everybody was pushing to start breaking ground or in the middle of their project, so it has put us behind. But I'm confident in our developers and the contractors that they have that will keep pushing and get these projects online.
It's definitely put us back. We're used to trying to make that up in the field, and I think we'll see some of that with these projects. You know, the projects that were already in place and were already underway, I'm not worried about delivering within a reasonable time frame. We're probably about 2 months behind on the Parker Durand right now. Still hoping to get it opened in the first part of 2021, though.
And are there any projects that you would say now cannot be completed in 2020 because of the late start and now should be looking at 2021?
If you're talking about projects that are already in construction, it's pretty much simple math. You stop working for 8 weeks, you're 8 weeks behind. But projects that are in the pre-development phase, that's a different matter altogether. And I think, you know, we've been working closely, all the developers in the community have been working closely with the city and the mayor's office and his team to really look at what things we can do to expedite those projects and get them moving again as well. And I think the recognition we all have to bring into this is that many of these projects were commenced or conceived of in a fundamentally different era than the one we live in now. And that era, you know, in my personal view, began around 2013, 2014 when the mayor and his team really led this city into an unprecedented level of growth and development in our recent history. And I personally, I'm very confident we can get to a new era that looks like that again, but I think we're all going to have to roll up our sleeves and recognize that a lot of the economic underpinnings of that prior era of growth have been scrambled. And but this is a town that has figured it out before, and I'm confident we'll do it again.
Okay. And Your Honor, are you aware of any projects that may be in jeopardy or that may have had to change their timeline or just get scratched because we've lost 2 months through nobody's fault, but just the clock is what the clock is.
Nobody's told me anything scratched, but if you were going to start a project where you were planning to have it enclosed before the winter and you've lost 2 months, some of those may get pushed back to the spring. Everybody's looking at the economics of their assumptions, but you're going to see some major projects get off the ground still this year. And we'll see what the economic effect is and how long it lasts, how fast people get back to work. So there's no doubt there'll be less construction this year than there was last year, but I still think there's going to be a lot more this year than Detroit would have believed 5 or 6 years ago.
Okay, and last question from me. In terms of District Detroit, they seem to be finally getting some momentum behind them. Obviously, everybody stopped. They had no choice in that matter. Are you concerned that that may throw that major project back into stasis or way behind?
You know, everybody has to figure out the financials, but I think Chris Ilitch did a nice job of doing a reset and getting focused. I think some of those early pictures, he was a victim of his own maybe grand vision, but they did a really nice job of resetting what could realistically be done, and it was a good plan that he was on. What the finances look like, you would have to ask him, but I feel confident that the Ilitch organization has a realistic assessment of what they can do and that they'll stick to what they say now.
Okay, thanks, everybody.
Okay, Mayor, just a couple of additional questions today. This one's from Crane's Detroit Business regarding any additional deaths at the nursing homes since we last reported. I know we touched on more positive tests, but have there been any other deaths that have been reported?
No, so since yesterday, I think it was 253 as of yesterday. There have been no new deaths since we reported yesterday.
Okay. And last question actually has to do with the NFL, Mayor. Apparently they're going to be, from Fox 2, they're going to be announcing their schedule tonight. And Eric Erickson wanted to know if you had any thoughts on how things might work with attendance.
They haven't consulted with me, so I guess I'll turn on the news and watch with everybody else.
Okay, that's the last question,
All right.
so everyone can watch.
Thank
the
you. Turn
governor.
on the governor at 3 o'clock.
Thank you.
Thank you.
Thank you, Mayor Duggan.